Health promotion. We are now in chapter 7. We have to define, conceptualizing, using models, and some case studies. So most of the time when you study things like health promotion or health in general, or even in sociology or social work, case studies are one of those that help people to understand. You come up with a scenario, you come up with a situation, say, okay, let's see how this impacts health promotion, or what should have been done if we are trying to really promote health promotion. So these are another way, these are other methods or different ways to learn something. Case studies are very, very important. They facilitate the learning of certain concepts that without using the case study approach, most of the time will make it difficult to understand it. But once you use a case study, now you say, oh, this was what they were talking about. Now I understand what they are talking about. These are some of the outcomes. If you say we understand the idea of explain the root of health promotion. Now, usually the word itself, when you say health promotion, you promote something to benefit more than one person. You see, you promote something to benefit more than one person. And in most cases, in doing that, will take some resources. We take some politics, will take the legal system. Even now, we're dealing with the COVID-19. There's a lot of health promotion going on. Some form of health education, but a good chunk is health promotion. The wearing of the mask is a health promotion strategy. The distance, 6 feet distancing, is health promotion. Washing of the hands is health promotion. Because here now they are saying, okay, you want to maintain your health, you also have to make sure that what you do maintains the health of the other person. You promoting, you passing the baton of good health for another person. And most of the time, in some cases, it could be a challenge for some people. But not doing it will not only impact the person who is refusing to do it, but also will impact the health of others within that person's environment. So to apply 3 different framework, models or topologies. They explain the scope of health promotion to different contemporary topics. 3, to explain selected principles of health promotion practice to a case study. The root of health promotion. Health promotion emerged from health education movement. See, health education, first of all, health education itself is you are given the information that you need to making sure that you do not get sick. You see, that is the health education piece. And most of the time, people choose to do it or don't do it. So, for instance, how many people have been told, don't eat, say, or don't smoke? Some people, after hearing the information, the side effect of smoking, how it can impact their overall health, gave up smoking. Some people did not. But again, even though they might continue smoking, health promotion has to kick in. The community has to come up with certain guidelines to promote the health of those people who don't want to smoke. And they have to put certain policies in place to enforce certain policies. If you are not willing on your own to stop smoking, we cannot force you to stop smoking. But we can put some brakes. If you are in public places, in public gatherings, wherein there are other people, health promotion comes in. Because now your behavior is not only affecting you, but it is also affecting others. See, when your behavior or one's behavior impacts the health of others, then health promotion kicks in. And most of the time, health promotion is one of those. It has some legal, it has some enforcement. Even the idea, okay, people don't drive drunk, or okay, even though you can kill yourself, but if you get your alcohol and you go into your room and drink as much, well, it's a choice you make. But if you, after drinking that amount of alcohol, decide to engage the public, acting as a nuisance, or worst of all, driving, wherein put other people's health in jeopardy, then public health will make sure that the law will come after you. And that's usually a consequence for not obeying the rules or the laws that are put in place about drinking and driving. Health education, noticeable in the early 1900s, with emphasis on cleanliness. Wash your body, wash your mouth, wash your hands, keep your body clean, your clothes clean. Those are passionate behaviors, and therefore responsibility for one's own ill health and health. So health education is purely a passional. You decide not to brush your mouth. You know what happens when you start talking and you have bad breath, how your friends can really relate to you. It's a passional. The Central Council for Health Education was founded in 1927. This explains why health education is often viewed as the main What is health promotion? Today, health promotion is more than personal and population education. Defined in number of ways, the process of enabling people to increase control over and improve their health. It's a process of enabling people to increase control over and improve their own health. See, as with anything, a very good equation, some mathematical equation. Health promotion is equal to health education multiplied by healthy public policies. Let's go over the formula one more time. Health promotion is equal to health education multiplied by healthy healthy public policies. Health promotion is equal to health education, which is more of the information you need to know about the impact of certain behaviors, how they can help you to be healthy. If that fails, it is being multiplied by healthy public policy. See, promotion now deals with the public. Health education is with the individual. Or since the individual lives in the public, in the community, that individual's behavior impacts the public. So public has some policies that when they go against those policies, then they are in violation of not only their own health, but the health of others. Good example. Health education. Somebody sat through the class, told about don't drink alcohol. Or if you drink, drink in moderation. One glass, two at most, and in most cases, it varies for women as well as men. That is basic health education. But if you've not started drinking, don't start. Because most of the time, some of these health behaviors that really leads to a lot of problems down the road are very, very addictive in nature. Very first time you started drinking, one glass, one can was just enough. Now, to get to that same kind of feeling that you had the first time, you need two. And after some time, you need three. And after some time, you need four. So now your health is you putting your health in a bad position. And when you are at that point, your behavior is likely to affect the public, the health of the public. So the public, through the help of politicians, through the help of respective groups like Mothers Against and Drunk Driving, came up with certain guidelines. So when you are found intoxicated, you have some problem to pay. You have some responsibility. So again, health promotion is equal to health education multiplied by healthy public policies. The scope of health promotion activity, the frameworks and models are tools that help explain phenomena. Many tools developed to explain the scope of health promotion. You have Tannehill model, 1985 model of health promotion. Needham and Wells, 2000 topology of health promotion. It is 1991 model of health promotion. Tony's and Telford's 1994 empowerment model of health promotion. You have Kaplan and Holland's 1990 four perspective tips on health promotion. So one thing that you can, whenever it comes to these things, different people have different approaches to addressing some of those things. So don't get so concerned as to why do they have that many. It's just like you want to go to Virginia State University. You can start from various routes, but towards the end, it gives you two routes or three at most. Either come through Ettrick, through Colonial Heights, or downtown Petersburg. So depending on how all the various routes that you might have taken, they all bring you to the same place. So they might have a different kind of way of framing words, but at the end, the goal is the same. You have the Chase model of health promotion. You see the four quadrants. Health persuasion needs to focus on why behavior is happening. So, because most of the time you have to be able to do away with why the behavior is happening. Because if you only all you're doing is you're trying to just be on the this no, you have to know what is the root cause. Say for instance, you have a garden and there is a particular type of plant that continues to show its heads every now and then. If all you do is just cut the stem, guess what? After some time, that stem will grow again. Most of the time, a better way to really deal with a behavior is know the root cause, try to address it at that source so that it doesn't happen. You see, now you see the arrows here, they are not pointing to, they are just pointing to, you don't say, okay, it starts there, it starts. You can start at any point with this as long as you are addressing each of those areas. At the individual level, why is it happening? You're dealing with the behavior. Then you have personal counseling, greater control, you encourage the person to place, or tell them, give them a good dose of the education side of the whole thing, how it might impact their health, their future. You deal with those personal counseling, the greater control. Okay, you negotiated authorities. Then at the authoritative side of things is the legislative action. Focus at a resource policy. So depending on the situation, do the people that are, is the behavior a behavior that can be dealt with lack of resource, provide that resource. That's the legislative action. Because when you provide that resource, you can help the community to develop empowerment. Collectively, they can develop some empowerment to assist people to deal with some of those challenges. And give people the skills that they need to be able to help people solve some of those problems. Create those centers wherein people's health can also, because most of the time, when we talk of health promotion, it does not has to be criminal. Say, for instance, okay, people dealing with issues like with people with obesity. Most of the time, people dealing with obesity, maybe lack of activities, or you have in their communities, they don't have grocery stores, they have convenience stores. How can we work with those convenience stores so that they can have healthy produce, so that they can carry healthy items that can improve the health of that community? You see, because most of the time, just pinpointing the issues and saying, don't do this, it's not enough. If you are going to investigate to find out what are the root causes, and by chance you happen to know, then make sure that you act appropriately to address some of those root causes. If obesity is the issue, it maybe try to see what you can do with a sort of diet that is readily available in that community. Try to see the physical activities. There are places for recreation for people to engage in some physical activities. And also create that support network among members of a family to help each other to develop some of those healthy habits, so that with time, the number of people overweight can be controlled. Because if you control the number of people overweight, you are controlling also the number of people with diabetes, and also the number of people with heart-related issues, and also the number of people with certain forms of cancers. And as you can see, each of these other diseases will cost the community far more to treat than to prevent. See, health promotion to a greater extent is more into the prevention. We know this is what is causing this. Come up with certain ways, meet with the community people, see how best we can put this address this issue, how all of us can come together, come up with a game plan to address this situation, so that the members of the community have a buy-in. They become in charge. They are made, empowered. They become in charge of their health. Use the resources within the community to enhance the health of the community. Okay, BOT's model applied. Exam 2, axis 1. Type of approach used: top-down, authoritative, or bottom-up, negotiated or owned by client. Size of approach. Now, most of the time, going back to say top down, most of the time has a much difficult challenge in people engaging in health promotion activities. But when it's from bottom up, from the grassroots level, let them be in charge of it. You know the problem. You know what are the root causes. You know the individual impacted by this. You know the impact of some of the health related issues. Most of the time, what you really want is the legislative, those people in power, to help you with the resources so that you can be able to address the behavior. It's very, very important. It's much, much easier for an idea or a program starting from the bottom, starting from the grassroots level, people coming up with their ideas, with their ways, for that then to be much more successful than when it's from top to bottom. It's a good example, even with the way some of these things people have interpreted the wearing of mask. Some people see it as being authoritative. Government coming down telling us what to do, this. Maybe at the earlier stage, there could have been a different way of introducing that concept, wherein people don't see it as something coming down from the top, but something that comes from the bottom with the support of people from the top. Because it's much easier to sell something within family members than to sell something that some people think is from the government. So categories, 4 types of activities. Personal counseling, working with dietitians on food and physical, individual personal plans and goals. Health persuasion, e.g., example campaign of eating 5 fruits and vegetables a day on TV. Legislative actions, e.g., laws that subsidize the price of healthy food and stuff. So going back to those neighborhoods wherein you're talking about not having very good and healthy healthy food, have convenience stores. Work with some of those people in those convenience stores to help them have healthy stuff, so that when people within that neighborhood, they can be able to afford fruits, they can be able to afford vegetables, so that they can be able to engage in healthy diet. You see, because most of the time is, again, it's much, it costs less to prevent than to cure. So if the politicians can come up with certain actions, come up with some monies to help those people with those stores, or give them certain breaks that, okay, if you build your store here, you will have certain tax breaks wherein you will have to pay less tax, and as long as you are able to provide healthy produce for the people that you serve. Community development, communities producing and distributing food themselves. You see, at times you have this community, you have some communities who really don't have any healthy produce. Then you start developing some of these community gardens wherein they grow their own food and distribute them among themselves. You have community farms. People go there, produce things, and sell those things at a cheaper rate to others within the community. And at times, government can also supplement, helping them with cost of certain things, like fertilizer or machinery or certain things. You see, because mostly, again, everybody is benefiting from situations like this. When everybody in the community is healthy, the government also benefits because they have a productive citizens. But when the community is sick, productivity is diminished, cost of maintaining their health becomes extremely expensive. So again, these are very good, simple, due to the personal counseling, working with dietitians on food and physical individuals' personal plans, and goals. Bring them in. Somebody who is 400 pounds. You cannot get 400 pounds to 200 in a week or even in a year if you're really doing it the right way. Start somewhere, because most of the time with weight gain or weight loss, you start slow, you get to a certain point, instead of 1 pound being lost, after some time you'll be losing 5 pounds. But to get your body to at that point, you have to develop it in a gradual manner. Instead of eating the entire pizza, say, okay, I'm going to eat 3/4 of the pizza this time. If you've been used to eating the entire pizza, I'm going to eat 3/4 of the pizza and have some fruits and vegetables. They will take the 1/4 and the 1/4. And as you continue, then you say, oh, now I'm going to have half this in the size of the pizza. See, gradually, it's a gradual. And you also develop other food substitutes that can replace some of those unhealthy substitutes that you have in your convenience store. Maybe you build and they can build a grocery store with other healthy produce, not only the sugar, the fat. You see, because most of the time is the sugar, the fat, and the carbohydrates. Too much of those three is tastes sugary, tastes good. Fatty also tastes good, and a lot of carbohydrate. So you try to reduce some of those things. Try to fill the shelves with less of those fat, sugary, and carbohydrates. Start to replace them with fruits and vegetables. And people's health will start to improve. Now here you see, if you look at the arrows, you have the lobbying, advocacy, mediation. People who are really big in trying to making sure that people's health are okay. They lobby for good health public policies, wherein if they need some governmental support, so that people can be able to engage in healthy habits, healthy eating, and can be able to provide healthy meals. It's a coalition, a group of people within the community. They all come together. At times, some of these things, if you watch closely here, all starts at the bottom: health education, the empowerment model, health education. People provide all those, with health education, you have raising the conscience of individuals as to the issue of the health that people are faced with. You empower, the community. Now, the public creates that pressure through coalitions that will give rise to the healthy public policy to develop some social, economic, and environmental influences. See, these are all geared towards health. Depending on, say, for instance, poor drinking water. People within the community have to collectively bring some of those issues to the forefront, so that the legislators can develop healthy public policies that can impact the social and economic environmental influence, making sure that the water that people drink is free from bacteria, is free from heavy lead, is free from contaminants. It's clean. to be able to maintain health. Again, health education for some individuals empowers those individuals to be able to take care of their health. And also here, it also helps to reinforce the health services. You approach it from different angles. You start with the education, the health education, then it branches out. Wherein it becomes really critical conscious. See the impact. If you don't do some of these things, how is it going to impact you, your family, the community, the nation? What goals do you have? See how some of those behaviors, if not properly handled, how they're going to mess up your goals. And tones and Tilford's model, health promotion, state interaction between two main sets of processes for health improvement, development and implementation of healthy public policy. That's one. Health education in which people are empowered to take control of their lives. For example, is attempt of Jamin's school dinner campaign, where school meals was brought into public consciousness and led to standards for meals and an increase in the budget for school meals. Only when these two approaches work in parallel can the conditions for living and individuals' behavior aspects of health be addressed. So these are same approach, but same goal, but different approach. Here is the state's interaction between two main sets of policies for health improvement, development and implementation of health policy. Now, how do you develop? How do you come about developing? Now, you have to use the grassroots level. You have to hear, you have to engage them at the grassroots level. Same with the previous model. You have to do the advocacy. Same. See, again, you have to empower the people, provide education. Same thing. You provide primary and you provide health education so that the individual is empowered to be able to take care of their health. See an example here in Jamie's school diners campaign, where school meals were brought into public consciousness. There was a situation wherein the schools were not providing the right type of meals for the students. So what happened? There was a campaign and they increased the budget so that the quality of the meals were improved. See, it takes that kind of approach. Okay, I'm going to end the lesson here today, and we'll pick it up the next time. And one of this also, I want you to start thinking about some health promotion activities in your respective communities, so that we can see if we can talk about some of those and see what we can do. You have a nice one. Take care.